So at this point, what I would like to do is I'm going to walk you through the consultation process. And this particular process should only take maybe about 5 to 10 minutes. And what I really like for individuals to do, it helps me out tremendously, is first and foremost to kind of get an idea and an understanding as to what they would like to change about their skin and how I can help them. In the back of your manual, you are given a consent form. I highly recommend that you read through the consent form yourself and make sure that you understand it. And then we also need to have the client sign the consent form also. So feel free to, you can use this consent form if you want to, or you can go ahead and revamp one yourself if you would like. So at this point, my client that I have with me today, her name is Amy. So we're going to go through the whole process now and see what we can do for her. Hi, I'm Nicole.
Amy, nice to meet you.
Nice to meet you. So first things first, I just want to ask you a couple questions.
Okay.
You are here today to see me for microdermabrasion.
Correct.
Do you know much information about it?
I know a little bit about it.
Okay. First and foremost, microdermabrasion has been around for 13 years now. So it's been around for a long, long time. Over the years, technology has gotten better and better and better. So there's more benefits to it. What you can expect from this treatment is your skin is going to look better, it's going to feel better, and when I ask you kind of what your chief complaints are, how I can help you, I will let you know if that's a realistic goal or not, or we can get there.
Okay.
A lot of people, when they hear the word microdermabrasion, I think they get it a little bit confused with dermabrasion. So I like to explain this is a very light manual exfoliation of the skin. In some cases, on your face, it's going to feel a little bit more prickly than in others. And as we go through your treatment process, because I'm going to be seeing you for a couple weeks, we will keep turning up the intensity, and it might get a little bit more uncomfortable each time, but it's not going to be painful. Okay. So I like people to know that. Okay? Mm-hmm. Now, most people laugh when I ask this question, but it helps me to understand where you're coming from. What is your chief complaint, and if you can change anything about your skin, what would you want to change?
My skin, I have a lot of little blackheads, whiteheads,
okay,
and I have some a little bit of sun damage on my cheek area, and I notice that every once in a while I have some fine lines around my eyes.
So are you doing anything right now to help with this at all?
I wear sunscreen.
Okay, do you wear it every day?
No.
Okay, that's all right. We can change that,
okay.
No problem. So main concern is eyes.
Mm-hmm.
And then we've got some congestion that we're dealing with. Okay. How about your neck and your décolleté? Have you ever considered doing treatments there at all?
You know, I hadn't considered that, but I have noticed that I do have a lot of congestion, as you were saying, in that area also, as well as on my cheek and the chin area.
Most women in general, myself included, I sometimes forget about the neck and décolleté, but that's why I like to bring it to your attention. What we can do today is we can do your face. And then on your next treatment, if you decide, this is fabulous, I love it, let's do my neck and my décolleté area, we can incorporate that into your routine also.
Okay.
Okay? The other thing I do need to ask you, are you currently on any types of medications that I need to know about?
No, I'm not.
Okay. Are you on any type of blood thinners at all?
No.
Okay. So any type of major skin condition, disease, or anything like that that I need to know about?
No.
Okay. Do you consider yourself to have sensitive skin at all?
I wouldn't consider myself to have sensitive skin, no.
Okay, alrighty. Any other questions or concerns that you have?
No.
No? Okay. I see you wear glasses, so you do not wear contacts.
No, I do not.
Okay. The other thing I'm going to ask you to do is when I get you onto the bed, I would like for you to remove your earrings for me, and I'd like for you to remove your glasses, and then I'll go ahead and drape you. Okay?
Okay.
During this treatment, I'm also going to put some cotton batting into your ears. The crystals that we use are aluminum oxide crystals, which is by far more superior than any other crystal that's on the market. You do have a couple other options, whether it be a salt or a sodium bicarb. I prefer aluminum oxide crystals, and the crystals that I use are considered medical grade class 1 crystals, okay?
Okay.
So you're going to kind of feel those here and there, and that's what's going to be doing the scrubbing action. And then you're also going to feel the suction too. Out of the two, the only thing that you might find just a little bit odd is the suction itself. But that's what's going to get the blood flow going. That's what's going to help with the fine lines and wrinkles around the eyes. Now the aluminum oxide crystals in the scrubbing That's what's going to help to unplug your milia and the congestion that you are feeling. So there's two main modalities that we're going to use out of this one machine that's going to get you the benefits that you want.
Oh, okay.
So by you expressing to me that your eyes and you're concerned about congestion, in the perfect world, and depending on what your life will dictate, I would like to see you for at least anywhere from 6 to 10 treatments, anywhere from about 7 to 10 days apart, if possible. It's very easy to do. You can come in on your lunch, you can come in after work if you want to. I will be removing your makeup for you, or if you find a day where you're not wearing makeup, just come on in with nothing on your face and I can go ahead and treat it that way. A lot of people ask, well, great, I'm going to have this done. Am I going to be red? Am I going to be blotchy? You know, what's going to happen afterwards? What you can expect from this treatment is when you get up off of the table and you look in the mirror, you're going to see some redness and a tiny bit of blotchiness here or there, but that's all normal because that has to do with the blood flow, which is what we want the benefit. That's what's going to help with some of your chief complaints. You also might experience some slight peeling or some flakiness, which is okay. You stressed to me that you really don't do a whole lot with your skin, so I can almost guarantee you that you probably will get a little bit of peeling and a little bit of flakiness, which is perfectly fine. Okay. I do have a consent form I need to have you read through and sign and date for me. And if you have any questions on the consent form, please feel free to ask. The other thing on here too that the consent form does go into, which you and I have already spoken of, you don't suffer from any major skin disorders or diseases or anything like that, but it will touch on that for you. But for legal reasons, I do need to have you sign it so you understand the treatment that we are doing.
Okay.
Okay?